Well, across Europe, hospitals are under increasing strain. Germany has seen a much sharper rise in coronavirus cases than expected. The economy minister says infections are likely to reach 20,000 a day by the end of the week. German Chancellor Angela Merkel had previously projected that number to be reached by Christmas. The Czech Republic's death toll has doubled in the last 2 weeks to over 2,300. The government there will look to extend its emergency powers until the start of December, while restaurants and shops remain shut. And in Belgium, Europe's worst-hit country, doctors are being instructed to keep working even after they test positive for COVID-19. The country's top health official says it could run out of intensive care beds in just over 2 weeks. Well, let's cross over to the Belgian capital. Our political editor, Darren McCaffrey, is standing by. Darren, the situation in Belgium looks like it's getting bleaker by the day, and hospitals are feeling the strain in more ways than just one.
Yeah, it really is quite bad, deteriorating quite quickly. As you say, pretty grim news from Belgium. Day after day here, we're seeing around 17 to 18,000 cases on average. Which, remember, this is a country that only has 11.5 million people, over 500 admissions to hospital every single day. Not a surprise then that those hospitals now are struggling to cope. As you talked about, ICU beds, fears that they could become full within weeks. We know yesterday, for example, Belgium asked if it could transfer some of its patients to the Netherlands. They refused. They're currently discharging coronavirus patients early if they've recovered sufficiently enough, simply because they want to free up those beds. And you're right in pointing out that in several hospitals in Wallonia, the authorities have said that doctors and nurses should incredibly carry on working, even if they have tested positive for coronavirus, if they are showing no symptoms. The fear at the moment is not just that they may run out of capacity when it comes to hospitals, but they are quite quickly running out of staff too. One doctor in Liège in Wallonia saying that they've got all the equipment that they didn't have back in the spring. They've got the gowns, the PPE, the masks. What they don't have are the doctors and nurses to put it on. The expectation is tomorrow, Oliver, that Belgium will surpass the peak of hospitalisations that it saw back in April. This second wave, much worse it seems here than the first, and people are comparing Belgium essentially to Bergamo, to northern Italy back in March. But it's not just, as you say, in Belgium. This is a case in which we're seeing the second wave hit Europe quite hard, in certain parts harder than it did first time round. And I've been speaking to Ville Niinistö. He is a Green Finnish MEP about the situation. And I began by asking him, how has Europe yet again ended up in this situation?
I think there was a mistake in around June, July, to let relaxation take over, the understanding that there needs to be a sustained, continued focus on getting over the pandemic, also for a possible second wave. So people were the pressure was so strong in the spring that everybody thought that this will be enough with a few months of lockdown. And since it was not the case, I heard in a number of experts saying that we should not let ourselves be fooled by a temporary better situation when there was no vaccine available yet.
But the problem is, of course, governments are also trying to protect businesses and the economy. Particularly,
Yes.
of course, tourism was a big issue in the summer for lots of southern countries. It was almost an impossible task in many ways.
Sure.
So, I mean, this is the question. What does governments, what does the EU do going forwards?
Well, I think, again, there needs to be EU-level coordination of what are the priorities of action needed. There needs to be continued focus on funding to haste the use of vaccine development and get the vaccine very rapidly in the spring to all countries. So this is something that the EU has to be very active on. But obviously there should be more also focus on kind of like having, basically there are two strategies at this point. Those countries that have too many cases to speak about smothering the whole crisis, they need to have continued longer-term restrictions that people can live with, that the economy can still continue as well as possible, and then trying to to get the surge down. But in a country like Finland, there's still a possibility to smother the whole crisis. So surgical short-term restrictions can actually be better for the economy and better for the health in the long term when you can ease them off afterwards. So there has to be two different ways of long-term restrictions and then surgical, very exact restrictions that are stronger if necessary.
And just very finally on this, because it is a really complex and difficult task and no one underestimates that, but you talk about long-term restrictions, but isn't the problem that actually in large parts of Western Europe in particular, but elsewhere in Europe as well, people are fatigued. They've had enough of this. They don't want these restrictions. And you can put in all the rules you want in the world, but if people aren't going to abide by them, they're pretty meaningless. And at some point, people would suggest that, you know, life may have to just get back to normal, despite the horrific health costs.
Well, in that case, I think you can compare the experiences of Sweden and Finland, two countries that are otherwise in rather similar positions. Sweden did allow life to continue during the spring and also this autumn, but they have something like 10 or 20 times more fatalities and cases than Finland, but the economic cost has been as severe as in Finland. So my point is that health and economy are not against each other. You can protect health by having well-coordinated, well-placed restrictions surgically at the right time, and then a smaller amount of longer-term, more easy to sustain restrictions in order to avoid a third wave, for example, in the future before the vaccines get. So this kind of like that you go drastically, ease drastically all restrictions and then go to full lockdown. Obviously, that's not a good method, but that has been the case in some countries, but easing all restrictions is also a bad strategy. So you have to be better in your timing, basically, but be ready to use restrictions. And that will also protect the economy in the longer term, because you can then ease off them as well if you actually limit the second phase.
Oliver, this is not an easy task, either at regional, at national, but certainly at supranational level, with Brussels trying to coordinate efforts. In large degree, it has failed to do so so far, as different countries have pursued different strategies, rather understandably, it must be said. Now, tomorrow we are going to hear from Ursula von der Leyen. She's going to announce a whole range of measures from the Commission to try and get better grips of this crisis. We think it's going to focus, for example, on helping to test citizens across Europe to trace where their infections are, to again ramp up the idea of trying to help coordinate the vaccine process, which some scientists hope could begin certainly at the start of next year. But also the countries, and again this has been talked about many times before, need to better coordinate travel and quarantine restrictions when people do move between different EU member states. Charles Michel is then going to chair a council meeting on Thursday remotely with the EU 27 leaders to try and hammer home some of these points and make them a practical reality. I'm talking to him tomorrow in an interview. We'll discuss many of these really difficult and complex issues, and we'll bring you that interview tomorrow here on Euronews.
Thanks, Darren. Darren McCaffrey there, our political editor, joining us from Brussels.